All right, ready to dive in. Today, it's all about this at-home health testing thing.
Oh, yeah.
It seems like everyone's talking about it.
Right.
You know those kits you can get,
Huh.
test everything, like vitamins?
Yeah.
Even like your ancestry from home.
It's pretty wild.
It really is like having like a lab right there in your bathroom.
Yeah.
We found this really interesting article all about it, actually. It's from December 7th this year, so super recent.
Oh, wow. Okay.
Yeah. It's called At-Home Health Testing, Revolutionizing Personal Health Monitoring. So, I mean, where do we even start with all this? There's so much out there.
It is, like you said, exploding. It's becoming so accessible, which is pretty amazing.
Yeah,
I think a lot of it is this idea of empowerment that you get from it. Like, you're not just waiting for a doctor to tell you what's going on. You're like, hey, I can take my health into my own hands, you know?
totally.
Yeah.
And I think that's what's so appealing to people, right? Like, it's this kind of knowledge is power kind of thing. But, I mean, with so many tests out there, how do you know which ones are actually worth it? I mean, are we all supposed to be checking our cholesterol like every week now?
Right. No, not necessarily. It really depends on, your individual goals, what you're concerned about with your health.
Yeah.
That article, actually, it breaks things down by category, which is pretty helpful, I think.
Oh, okay.
So one of the most common types is vitamin and mineral deficiency tests.
Oh, right, right. So that's like checking if you're low on vitamin D or iron, those kind of things.
Yeah, exactly. Like B12, magnesium.
Okay.
They're really useful, especially if you have, maybe some specific dietary restrictions or just things in your lifestyle that might put you at risk for being deficient.
Right. Okay.
Like, let's say you're vegan. You might want to keep an eye on your B12 levels.
Yeah, that makes sense. And speaking of vitamin D, I noticed in the article they were saying like the vitamin D test got a 9 out of 10 for accuracy.
Really?
Yeah. I thought that was pretty impressive.
Wow, yeah.
Is there a reason for that? Do you know?
I think that high score has to do with how they actually do the testing. It's
Yeah.
gone through this rigorous, I don't want to get too technical, but basically it's been checked by an independent lab. So that 9 out of 10, it's pretty reliable.
Okay, that's good to know. I feel like a lot of people are going to be interested in the next category too. Cholesterol and all those lipid profile tests.
Uh-huh.
The ones that look at all the different fats in your blood
Yeah.
and kind of give you an idea of heart health. Right?
Exactly. You've got your total cholesterol, your HDL, your LDL, your triglycerides, all those things they talk about.
Yeah.
Really important if you want to kind of assess, your risk for heart problems down the road,
Yeah.
especially, if you have a family history of heart disease, or maybe you already have high blood pressure or
Diabetes, yeah.
diabetes, things like that.
So it's not just about like getting older. It's about like knowing your own personal risk factors.
Yeah.
Okay. The cholesterol test got the decent score too, actually, like a 7.5 out of
Yeah.
10 in the article. But I'm guessing there are things that can mess with the accuracy there, right?
There are a few things, like how recently you've eaten can actually make a difference.
Oh, really?
And even like the method they use for the test can make those numbers a little different.
Interesting.
Yeah, it can be kind of tricky. That's why, whatever you see on that at-home test, you really want to talk to your doctor about it.
Yeah.
Get their take on what it means for you.
Okay. Yeah, that makes sense. All right, on to something that I think is getting more and more popular, hormone level tests.
Oh, yeah.
Seems like people are really starting to realize like how much hormones
Yeah.
affect everything, energy levels, mood, all that.
Absolutely. Yeah, we're talking about testing for thyroid hormones, testosterone, estrogen, cortisol. I mean, the list goes on.
Yeah.
And when those hormones are out of whack, you can see it in so many ways. Like if you're tired all the time, can't figure out why, or your weight's doing weird things, or you're not sleeping well, your moods are all over the place.
Oh, yeah. I've been there.
It can be a lot of things, but hormones are definitely a big one.
So if you're feeling off and you've, ruled out other stuff, maybe a hormone test is worth a shot.
Yeah, it could be. It could be a good first step. The article actually highlighted the thyroid test. It got an 8.5 out of 10, which makes sense because, your thyroid controls so much, like your metabolism, your energy levels, even your mood. It's a pretty big deal.
Wow. That is really interesting. So we've talked about tests for like deficiencies, heart health, hormones. What else is out there?
Well, this next one is a little bit different. It's kind of about looking back into, deep ancestry, genetic and ancestry tests.
Right. The DNA test. Tell you where you're from. And I think some of them even like connect you with relatives. Right?
Yeah, they're getting super popular. The cool thing is the article was talking about how they can also give you some insight into, if you're predisposed to certain health conditions. like based on your genes.
Oh,
But a really important thing to remember is it's not like a crystal ball.
right.
Just because you have a certain gene, it doesn't mean you're definitely going to get that disease. But it does mean that you can, talk to your doctor and maybe adjust your lifestyle, focus on prevention.
Yeah, so it's more about like awareness.
Exactly, just having more information to work with.
Right. Okay, and then kind of on a more timely note, I know a lot of people have been using at-home tests for like infectious diseases,
Yeah.
especially in recent years.
Oh, for sure, especially after everyone
Well,
with the pandemic.
right, being able to test for COVID from home, I mean, that was huge.
Absolutely. And you can test for other things too, like HIV, some STIs.
Oh, wow.
Yeah, I mean, it's really changed the game in terms of, how quickly we can diagnose things and start treatment.
And the article, they were saying how that was so crucial during the pandemic,
Yeah.
like giving people access to quick and easy testing. They even gave that COVID rapid antigen test a 9 out of 10 overall, I think.
Makes sense.
Yeah, those became so user-friendly, like so widely available. It was amazing how that all happened.
It really shows you what's possible with these at-home tests. Like, they can really respond to these big health threats and, again, give people that control over their health, which is, especially important when things are changing so fast in the world.
Right. And I feel like we've only scratched the surface here.
Oh, yeah.
What other kinds of tests are there?
There are tests for, like, allergies
Oh, right.
and sensitivities. Like, if you're trying to figure out what's making you sneeze or break out in a rash or
Got it.
even digestive issues, they can help with that. And then there are also like metabolic and fitness tests, which are becoming more popular, especially with people who are, really into optimizing their health and fitness.
It's amazing, I mean, how much information is available to us now. But before we go too crazy with all this, we should probably talk about the downsides, too.
Yeah, good point.
I mean, the article does mention, some challenges and things to be careful about. I'd love to get your take on all that.
Definitely. We should. Yeah. Oh, yeah, for sure. There are definitely some things to keep in mind.
So, like, first of all, accuracy. The article talked about how, not all these tests are created equal.
Right.
How can people make sure they're picking a test that's actually going to give them good results? Like, what should they be looking for?
Yeah, that's a great question. One thing that's really important is to look for third-party verification or like a certification, something like that.
Okay.
Basically, it means that someone independent has looked at the test and said, yep, this is accurate. You can usually find that info on the box or on the company's website.
So it's like a seal of approval.
Exactly.
Okay, cool.
Yeah.
What about regulation? The article mentioned that not all at-home tests are, like, regulated the same way.
Right. Yeah, that's another important thing to think about. Like, some tests are way more regulated than others,
Okay.
especially those ones for, like, infectious diseases,
Right.
because, those can impact public health. So there's a lot more oversight there. But then some other tests, like for vitamins, might not have as much.
So how do you know? Is there a way to tell if a test is, like, meeting certain standards?
It really comes down to doing your research, choosing companies that have a good reputation,
Mhm.
ones that are clear about how they make their tests and how they do quality control. And if you're not sure, it never hurts to ask your doctor.
Yeah, okay, that makes sense. And speaking of doctors, what about follow-up care? Like, let's say you take an at-home test and you get a positive result. What do you do then? Do you need to, like, run to the doctor immediately?
It depends, really. It depends on what kind of test it was and what the result actually means.
Okay.
Sometimes the test will tell you to get it confirmed by a doctor, but sometimes they'll give you instructions right there, like maybe lifestyle changes you can make or things you can buy over the counter.
So you really got to read those instructions carefully.
Yeah, exactly. Don't freak out right away. Just, figure out what the results are actually telling you.
Mm.
And if you have any doubts, definitely talk to your doctor, especially if you're having symptoms or, if the result seems really weird.
Okay, yeah, good advice. Another thing that came up in the article is data privacy.
Oh, right.
I'm sure a lot of people are probably wondering about that. Like, what are the risks of sharing your health data with these companies?
It's a good question, and you're right, it is a concern. Because those privacy policies, they're all different. Every company has their own.
Yeah.
So you really do have to read them carefully. Look for companies that are upfront about what data they collect, how they store it, what they use it for, all that stuff.
So basically, transparency is key.
Exactly.
Like, you want to know that they're, taking your privacy seriously?
Yeah, and if you're really concerned about it, a lot of those companies have like optional programs where you can share more data. You can always opt out of those, You have the right to control your own data.
Okay, good to know.
Yeah.
And last but not least, there's the cost issue. The article talked about how even though at-home tests are generally cheaper than, going to a lab, the costs can still add up.
Yeah, that's true. If you're doing a lot of tests, it can get pricey.
Right.
So definitely factor that into your budget. And also, check with your insurance. Some plans actually cover some of these at-home tests.
Oh, okay.
Yeah, so it's always worth asking.
Wow. Okay, we've covered a lot here from, the different types of tests to all the challenges and things to watch out for. It seems like at-home testing is a really powerful tool.
It is.
But like anything, you have to, use it responsibly.
Exactly. You have to be informed and aware of the limitations.
Right. It's about that balance,
Yeah.
empowering yourself with knowledge, but also like being realistic.
Totally.
No.
Knowing when you need to bring in a professional.
Right. Exactly. So where do we go from here? I mean, what do you think this means for the future of healthcare? Do you think at-home testing is going to like become the norm?
I think it's definitely heading that way. I mean, we're already seeing this shift from like reactive healthcare, where you go to the doctor when you're already sick, to something that's more proactive. People are starting to take more control of their own health and well-being.
Right, like having your own personal health dashboard.
Exactly. But obviously, with any big change, there are like bigger implications to consider.
Oh, yeah, for sure. Like what kind of things?
Well, and this is something I kind of want to leave our listeners with. As at-home testing becomes more common, how do we make sure everyone has access to it? Not just people who can afford it.
Right. That's a really good point.
Because if we're not careful, it could actually make those health disparities, even worse.
Yeah. Not everyone has the same resources.
Exactly. So we really have to think about that. Like, how do we make this a positive thing for everyone?
It can't just be about individual empowerment. It has to be about like collective well-being.
Exactly. Making sure everyone benefits from these advancements.
Right. That's a powerful thought.
It's something we all need to be thinking about.
Wow. Yeah. A lot to think about for sure. This whole conversation's been like really eye-opening. We started out all excited about like all this health info we can get now, but then we got into the importance of using it carefully, ethically.
Right. It's powerful stuff,
It is.
But the more we know as individuals, as a society, I think the better we can like actually make this work for us.
Yeah, totally. Like I'm definitely leaving this conversation feeling like more informed, still excited about the possibilities, but also like a lot more aware of the downsides.
And that's really what it's about, I think. Finding that balance.
Yeah.
Seeing the value, but also being realistic about what these tests can and can't do.
Right. It's not just about the tech itself. It's about like us, how we use it, and what it means for, everyone.
Right. Absolutely. Ultimately, it's about living healthier lives, right?
Yeah. Making good choices. Well, this has been fantastic. Thank you so much for like walking us through all this.
Oh, it's been my pleasure.
It really has been a deep dive for sure. For everyone listening, definitely check out the article we've been talking about. It's called At-Home Health Testing, Revolutionizing Personal Health Monitoring. You can find it online. It was published on December 7th of this year.
Yeah, and keep learning, keep asking questions. This is a conversation that's just getting started.
That's a great point. All right, well, until next time, everyone, stay healthy out there and keep exploring.